I would get a mammography. I just can't afford one.
I've been out of work for about 6 months and I lost my insurance when I left my job.
I know the importance of mammogram, but my insurance doesn't cover mammography.
I really don't have health insurance, and I can't afford to do mammography right now.
As health care costs continue to rise, employers often cut back on the health insurance coverage they offer their employees. And women who work part-time are often not covered at all. The result is that many women in Suffolk County have inadequate health insurance or no health insurance at all. But that doesn't mean they can't have regular mammograms. The Women's Health Partnership of Suffolk County provides mammograms at no cost to women 40 years of age and older, women under 40 with family history, mother, sister, or daughter diagnosed with breast cancer, women who are underinsured or uninsured, women with low income. But there are other reasons why women don't get mammograms.
No one in my family ever had breast cancer, so I'm not likely to get it.
I don't have a car, and getting to doctors is hard. And taxes are just so expensive.
I'm afraid to have a mammogram. My friend had a mammogram and she said it hurt.
I'm 65 years old, and I never had a lump. So why should I go looking for trouble by having a test done when I feel just fine?
If I'm gonna get breast cancer, I can't do anything about it anyway.
Mammography as a single test is the most effective method to determine early breast cancer. This is the reason why a program instituted at the age of 40 should and has been scientifically proven to reduce the mortality from breast cancer.
The Women's Health Partnership provides no-cost mammograms through its network of participating providers, many in private offices throughout Suffolk County, providing easy access for all women. In addition, the Suffolk County Department of Health Services mobile mammography van program offers clinical breast exam, instruction in breast exam, and mammography in communities from Amityville to Montauk and Huntington to Greenport. Each year, thousands of women in New York State are diagnosed with breast cancer, and many will lose their lives because of this serious disease. A disproportionate number of these deaths will be among women in minority and low-income groups. Minority women, particularly if they are poor, have a greater chance of dying when diagnosed with breast cancer. This is because cancers are found too late, and women aren't always aware that no-cost breast screening programs exist. That's why breast cancer screening is so important. Finding breast cancer early can save your life. If you're over 40, you should have an annual mammogram, an annual physical breast exam, and practice monthly breast self-exams. And while these are all important steps, the mammogram is particularly crucial because it is the most accurate early detection method we have today. In fact, tumors can be detected by a mammogram years before they can be actually felt. But mammograms are not foolproof. That's why women need to have a breast exam performed by their health care provider and do regular breast self-exams.
And sometimes women say, well, I don't know what I'm feeling. Why should I do it? I just couldn't make a diagnosis. We're not asking for a diagnosis. What we're asking you to do is simply find something that wasn't there before, something that's growing, or something that just feels different.
So So we really have to
The Women's Health Partnership has community outreach programs that teach women breast self-examination, BSE. Lay health advisors conduct these programs. They are women from different areas in Suffolk County that bring breast health education back to their communities to dispel women's fears and empower them to take charge of their own health.
This is the size.
At my church, we were told how to give ourselves breast exam. And also, we can go get screening at no cost.
It was very good. And it was fast. It was private. And I was very pleased when I got results from the doctor.
The good news is that most women screened get normal results. However, sometimes further testing may be required.
Sometimes after a screening mammography, you'll get a letter that says you need additional views or additional studies. This does not mean that there's a problem. It sometimes means that the radiologist just needs more information so that he can give a proper diagnosis.
The Women's Health Partnership helped me to get a mammography, but the mammography was questionable, so I needed an ultrasound. Transportation was going to be a problem, so I called the patient navigator, and she helped me.
Oh, great.
And everything's fine.
Great, great.
It's important for women to know that the Women's Health Partnership provides for not only screening mammography, but for diagnostic services as well. And if a woman is diagnosed with breast cancer, we're here to help her through her entire treatment and recovery. The partnership is just what the name indicates. We work with doctors, hospitals, and organizations that provide services to women throughout Suffolk County.
The bottom line is, in 9 out of 10 cases, breast cancer can be cured if found early. So early detection is the key. Don't delay. Don't let lack of insurance, transportation, or fear keep you from taking good care of yourself. Call the Women's Health Partnership to schedule a mammogram and a breast exam, and let us teach you how to perform a breast self-exam. Educating yourself about breast cancer can save your life.